Yo guys, what is up? Are you looking for all your pharmacy and medicine information? Well, you're in the right place. Subscribe so you don't miss any future content and let me know down below what you want to see in the future. Today's video is involving ACE inhibitors. I'll be covering the most important points you need to know. So let's get into the video. First of all, let's start off with what are ACE inhibitors? Well, it stands for angiotensin converting enzyme inhibitors. They work within the RAS system, which is the renin-angiotensin-aldosterone system. This system is involved in the homeostasis of fluid and electrolyte balance. Specifically, they stop the action of angiotensin converting enzyme. So the ACE enzyme usually converts angiotensin 1 to angiotensin 2. Angiotensin 2 is a vasoconstrictor. It means that the blood vessels are made tighter and smaller, which means greater pressure of the blood is forced around the body. With these medicines, that is now sort of inhibited, that's stopped, which means that the blood vessels will now be more dilated, larger, wider, which reduces blood pressure. Reduction in angiotensin 2 also results in the dilation of the efferent arterioles of the glomerulus, which are within the kidney nephrons. This reduces the glomerulus pressure, which we'll discuss later on in the video, because it can be beneficial, but it can also actually be negative in some patients. Hopefully that gives you a bit of understanding of how these drugs work, which will make it easier for you to understand the rest of the video. What are they used for? Why do we use these medicines? Well, they can be used for multiple conditions. Hypertension is one of them. They can reduce blood pressure. It's used in chronic heart failure, ischemic heart disease, diabetic nephropathy, chronic kidney disease if proteinuria is present. So because ACE inhibitors also reduce the levels of aldosterone, this promotes water and sodium excretion from the body, which can be beneficial in heart failure. In heart failure, there's a lot of water retention, there's edema, so reducing that can be beneficial. These medicines reduce renal perfusion. This is by dilating the efferent arteriole, and this has a protective effect in diabetic nephropathy and can slow down the progression of chronic kidney disease. Okay, we're going to move on to the adverse effects of these drugs, things you should be aware about, things that you might want to sort of counsel patients about. The first one is first dose hypotension, which means that after taking the first dose of a medicine, your blood pressure can drop quite a lot. Typically, when patients are being initiated on this, we say to take it at night, because if this effect happens and they're taking it just before bedtime, by the time that the drug actually has an effect, they should be in bed, which means if they get dizziness, feel unwell, it's a lot safer for that patient. And it is worth knowing that this effect is a lot more profound if the patient is already on a diuretic. Moving on, persistent dry cough. So stopping the conversion of angiotensin 1 to angiotensin 2 results in the buildup of a substance called bradykinin, and this is linked to sort of causing the dry cough. It's important to note it can happen at any stage of treatment. What we would then do is switch them to a angiotensin 2 receptor blocker. So an example of this would be losartan, and this would fix it, as this class of medicines don't result in an increased level of bradykinin. ACE inhibitors can also cause hyperkalemia. So the lower aldosterone levels, which we were talking about, also promotes potassium retention. So number one, you need to be cautious that your patient's not on multiple potassium elevating drugs at the same time. If they are and it's unavoidable, then you need to monitor them regularly. They can cause renal damage, a common cause of acute kidney injuries. The patient's in hospital, guys, and they're suffering with acute kidney injury. You need to make sure that their ACE inhibitor is stopped until that acute kidney injury is resolved. ACE inhibitors and NSAIDs in combination together vastly increase the risk of renal damage. So NSAIDs constrict the blood vessel going into a glomerulus, and ACE inhibitors dilate the arteriole leaving the glomerulus. Patients on ACE inhibitors, I would personally just avoid, use something else if possible. The next point is quite rare, but we need to be aware of it so that we can counsel patients on this. And that is that they can cause effects similar to allergic reactions, like facial swelling. If this occurs, they should stop the medicine and seek medical advice. So guys, those are my main points about ACE inhibitors. It is the majority of what you will need to know in practice. Let me know what you think, and if it helps you out. I'm Pharmacist Geek, and I'll see you in the next video. Peace!